I'm going to apologize. I'm getting over a cold, so if I have to stop for a coughing fit or to take a cough drop, I apologize. I think I'm probably not going to take the whole amount of time, and we'll save some room at the end for questions. But I wanted people to have, if they have questions, to go ahead and ask them during the presentation and not wait to the end. So I wanted to talk a little bit about acceptance and commitment therapy. My name is Dr. Brian Casey. I'm a clinical instructor at the University of Louisville. So the goals to recognize core principles of acceptance and commitment therapy. This is mostly an introduction, and I'm hoping to get people more interested in it so they can continue reading after the presentation. I have no disclosures. So I guess starting out, what is ACT therapy? It's a mindfulness-based therapy that uses acceptance, mindfulness, and behavior change strategies to increase psychological flexibility. So I guess there's the first problem. With any new therapy, you're going to learn going to be exposed to lots of new jargon. So what is psychological flexibility? I guess to put it briefly, it's the ability to adapt or cope with stressors. So ACT is rooted in something called functional contextualism and relational frame theory. I'm not going to get too deeply into that, but the takeaway is that because of the way the human brain works and human language works, bad is never far away. And ACT uses lots of metaphors, and the metaphor sort of explanation of that is you can imagine someone's wedding day. It's supposed to be the most beautiful experience of their life, but anybody who's had losses, like take for instance if you've had a family member recently die, you're experiencing something beautiful, you should share things that are beautiful, you want to share it but can't share it with this person, and suddenly you've brought pain into the most beautiful time of your life. So you can, regardless of how good things are at any given minute, pain is never far away. So my own experience with ACT therapy, I learned it from one of my mentors at UNC and decided to take some cases. I co-led some brief ACT therapy groups and supervised residents in a clinic which integrated ACT concepts into med management appointments. So how is ACT different from regular therapy or CBT? The goals of traditional therapy is mostly focused on symptoms with the implicit assumption that quality of life is based on severity of symptoms. So a decrease in symptom burden allows a person to have a better quality of life. You can think of panic attacks. If only we could get this person to stop having panic attacks or have fewer or less intense panic attacks, well then they would inherently have a better quality of life, or that's the assumption for traditional therapy. ACT therapy takes a different tact. It says decrease in symptoms is not the goal. Changing your relationships with the symptoms is the goal. The goal is to help the patient live a life worth living and then see how they feel. It's likely better. It would be weird if it wasn't better, but there's no guarantees. Quality of life is considered dependent on mindful, values-based actions, which is possible regardless of symptoms. So the concept of illness in ACT therapy is similar regardless of whatever their DSM diagnosis is. Painful private experiences are not pathologic. They are a normal part of the human experience. Fusion with our thoughts and experiential avoidance are also normal processes, but lead to more suffering. So that's sort of the overview, but more specifically, ACT identifies 6 core pathologic processes. I've got them listed, and we're going to go through each of these a little more thoroughly in a little bit. The dominance of conceptualized past and future, lack of contact with values, unworkable action, attachment to conceptualized self, cognitive fusion, and experiential avoidance. The flip side of those would be where you can intervene, so the therapeutic processes, contact with the present moment, acceptance, diffusion, self as context, values, and committed action. And we'll go through these in a little bit to further explain. So this is a diagram. It's called the hexaflex, and really it's just meant to demonstrate that each of the pathologic processes is attached to a therapeutic process, and they're all interrelated and share the common goal of increasing psychological flexibility. So getting into them a little more thoroughly now. Let's start with the first one, experiential avoidance. People frequently try to control their emotions, thoughts, or memories, and it's usually not doable in the long term. You can, short term you can do it, but not in the long term. Ways in which people frequently try to avoid their first-person experience is they distract themselves, they opt out, they try to think away, self-harm or substance abuse. Each of those can be effective in the short term, but not in the long term. Or if they are effective, then they narrow your life in a way that's probably not sustainable. The flip side of that would be acceptance, opening up to painful experiences. Other synonyms would be sitting with, making space for, or distancing from. This does not mean liking or wanting painful experiences, but making space for them in the name of doing something that matters. The metaphor would be wading through the swamp. So if you were a mountain climber and wanted to climb a mountain, but between you and the mountain there was a swamp, you would have to wade through the swamp to get there. You were going to have an unpleasant experience to get to be able to do what matters. The next pathologic process is cognitive fusion. In a state of fusion, people's thoughts feel like the truth, a command, a threat, something that's happening now, even though it's in the past or the future. The flip side of that would be cognitive diffusion. Watch your thinking. Thoughts are nothing more than words, images, and ideas that are present only in your mind. In a state of diffusion, your thoughts may or may not be true. They're not real threats, and they certainly don't need to be followed. So here's sort of an example. Someone may come in and say, I am overweight. And true or not true, they're fused with that thought. You want to get them to a space where they can say something more like, I'm having the thought that I'm overweight, or even better, I notice that I'm having the thought that I'm overweight. And mindfulness is one way to help people diffuse from their thoughts, because it's watching your thinking instead of being actively engaged in your thinking. Dominance of conceptualized past and fear future. So this gets back to the idea that pain is never far away. At any given moment, you can remember past painful experiences, or even if now it's good, you can be worried about an uncertain future at any given moment. The metaphor that ACT uses to describe this is the mind is the terrible time machine. It's constantly trying to get you into the future or into the past. It doesn't allow you to be in the present. If you were in the present, you would be here. You'd be able to more fully engage in what's in front of you and have more information about, is this the course of action you really want to take? Mindfulness does not have to be a formal meditation. You can mindfully walk, mindfully sit, mindfully eat. You could even mindfully have a panic attack. So mindfulness is in the present. It's an awareness process and not a thinking process. It's the concept of noticing. It's contact with the present moment. It's opening up to or experiencing with curiosity. It's the observing self. So this is a practice that I like to do with patients, and you could do it in the room with them, or you could do it as an assignment. You could do it, say, I want you to do this X number of times a day, or do this when you notice that you're not being present, but I wanted to go through it with you all. Plant your feet into the floor. Push them down. Notice the floor beneath you, supporting you. Notice the muscle tension in your legs as you push your feet down. Notice your entire body and the feeling of gravity flowing down through your head, spine, and legs into your feet. Now look around and notice what you can see and hear around you. Notice where you are and what you're doing. And that's a simple practice that you can do to get somebody who's not in the present back in the present moment. The next pathologic process would be lack of clarity of values. Why am I doing the things that I'm doing? People are frequently engaged in behaviors that are not in line with their own values, and sometimes that bears pointing out to them. So the flip side of that would be values or engagement in your values. What is it that's important to you? What do you want to stand for? You can ask, and sometimes you can sit down with somebody and go through a list of values. Which of these do you think fits best? But it's probably better to reflect back to them what their values seem to be. You know, if you weren't having these symptoms, what would you be doing? And why are those the things that are important to you and not other things? So unworkable action, impulsivity, avoidance, these are the patterns that pull us away from valued living and keep us stuck. And ACT is filled with acronyms. So fear is the one they use for this one. Fusion with your thoughts, excessive goals, avoidance of discomfort, and remoteness from values. The flip side of that is to do what it takes to live our values, even if it is painful. Well, let's make a plan. What do you want to do next? You want to make a plan that's meaningful in and of itself, and not just as a way to decrease their suffering. What I mean by that is, if you're thinking of just another way to distract them from their feelings, it's probably not going to be sustainable in the long run. You want it to have a plan that's engaged in their values. Attachment to conceptualize self. Everyone has a personal story or a narrative about who we are or where we came from. Sometimes these are true, and sometimes they're not true. And it's pretty natural to have them, but it's pathologic when people get stuck or people get fused to them. I'm bipolar, I'm shy, I'm anxious, I'm the victim, I'm right. When those are the things that begin to drive your behavior, then you're in trouble. The flip side of that would be self as context, the observing self. Some people will call this pure awareness. You are not your thoughts. You are a person who has thoughts. And there's a part of your mind that can notice when you have thoughts. This is very different from the Western usual view of what thinking is. You know, I think, therefore I am was a Western idea. This is saying something opposite. You are not your thoughts. You are a person who has thoughts and can notice them. So I wanted to do a brief guided meditation. This one's called Leaves on a Stream. Sit in a comfortable position and either close your eyes or rest them gently on a fixed spot in the room. Visualize yourself sitting beside a gently flowing stream with leaves floating along the water surface. For the next few minutes, take each thought that enters your mind and place it on a leaf and let it float by. Do this with each thought, pleasurable, painful, or neutral. Even if you're having a joyous thought, put it on a leaf and let it float by. If your thoughts momentarily stop, continue to watch the stream. Sooner or later, your thoughts will start up again. Allow the stream to flow at its own pace. Don't try to speed it up or rush your thoughts along. You're not trying to get rid of your thoughts. You're allowing them to come and go in their own pace. If your mind says, this is dumb, I'm bored, or I'm not doing this right, place those thoughts on a leaf too and let them pass. If a leaf gets stuck, allow it to hang around until it's ready to float by. If the thought comes up again, put it on a leaf and watch it float by another time. If a difficult or painful feeling arises, simply acknowledge it. Say to yourself, I notice myself having a feeling of boredom, or impatience, or frustration, or pain. Place those thoughts on a leaf and allow them to float along. From time to time, your thoughts may hook you and distract you from being fully present in this exercise. This is normal. As soon as you realize you've become sidetracked, gently bring your attention back to the exercise. Now I invite you, when you're ready, to slowly come back to your body. You can open your eyes and sort of take stock of where you are. So I've done that with patients before, and they thought it was incredibly meaningful, and they had never done anything like that before. People usually get, instead of sort of letting their thoughts come and go, they get hooked on their thoughts. Their thoughts are sticky. They have one thought, and from that thought flows a whole series of thoughts. And each time they try to escape it, it just makes it worse. Another thing I wanted to talk about is in Act Therapy, you're focused less on whether or not a thought is true and more on whether a thought is helpful or workable. So fact or fiction, what are you going to do when that thought shows up? Is it helping you move towards what matters, or is it not helping you move towards what matters? Yes, you're right, you may be the victim. And yet, is that thought helping you move towards what matters? So that's all sort of the background. When you get started with that, you want to get people on board to the idea that struggling with their thoughts is not going to be helpful to them, or the way that they're doing it isn't working. And that's called confronting the agenda. And people frequently have a good reason for the way in which they've interacted with their thoughts. And it may be difficult for them to let go, so it bears pointing out that, so you can ask, what is it that brings you to see me? And they'll tell you about the painful thoughts they're having, the painful memories, the painful symptoms. And you can say, and what have you done so far to address that? And they can talk about, well, I scream, I yell, I shout, I've gone to doctors, I've tried medicines, I've done this and that. I've tried distracting myself. I've tried, sometimes when those thoughts come up, I'll isolate myself or go to bed. I'll try to sleep it away. And you can ask, well, how did those work? Well, they may have worked in the short term, but did they work such that the thoughts never came back? And the answer is usually no. And usually over time, they get more intense. So this is another tool, or this is a major tool that I use with my patients called the matrix. And I'll have them I'll invite them to pull up their chair beside me, or I'll move beside them, and I draw out a little drawing for them. And it's a little silly, and I've sort of warned them, this is going to be a little silly, but I want them to bear with me. So this is a bunny, and this is a carrot. So which way do you think the bunny's going to move? They'll usually tell you, well, the bunny's going to go towards the carrot. Yes. And why is the bunny go towards the carrot? Well, the bunny goes towards the carrot because it's important to him. It represents something to him: food, nutrition, nourishment. So then I draw a dog. And now which way is the bunny going to go? Well, he's going to move away from discomfort. I tell people, there are many viewpoints, but this one is mine. The two ways in which a person could act is either away from discomfort or towards what's important to them. And after I've introduced this sort of framework with them, you can just use a shorthand. Was that a towards move, or was that an away move? So then if you haven't already done it, you can evaluate, well, what is it that you want to move towards? What is it that you want to make your life about? Is it friends, family, helping others? Frequently people will talk about creativity being a value of theirs, but they're not doing anything to engage it, and nature. So then it gets a little more complicated, and I'm not going to talk about it too much, but on the top is the outer world, and on the bottom is the inner world. So you can put in for them the values that they talked about: friends, family, valued activities. And you can talk about, what is it with you that's been getting in the way? And it's usually the thoughts, feelings, emotions, and memories that they talked about earlier. Okay, well, and how have you been dealing with that? Well, I've been doing all of these things. I've been distracting myself. I've been isolating myself. I've been trying to think it away. One thought leads to another thought, which leads to a whole series of thoughts. And self-harm. And these are usually things which are effective in the short term, but are not addressing the real problem. Or they're not sustainable or making it worse. Or substance use. I feel so anxious, I drink. And okay, well, how does that work? Well, it works great. And what happens when the alcohol wears off? And then you can ask them, well, when you're doing these things and you are isolating yourself and you're trying to think it away and you're using substances, are things better or are things worse? And we usually say, nope. When I'm isolating myself and at home alone using drugs, that's when the thoughts get even worse. So now you can point out to them they're in a cycle, that when they are having these painful experiences, the way that they are interacting with it is reinforcing it. When you say, while you're over here on the left, sort of caught in this cycle, what are you not moving towards? What are you not doing? It doesn't seem to me like you're moving towards any of these things that you find important. So would you be willing? So it sounds like you're pretty stuck. Would you be willing to make a plan to try to do something that's important to you, even though you're having these painful thoughts? So let's make a plan for how we're going to address this. How are we going to move forward? And that gets back to the commit an action. Well, let's make a plan for what you're going to do. Yeah, that can either be, what am I going to do when these painful thoughts and memories and emotions show up? Or is there something that I want to do that I'm not doing now? Do I want to get back involved in my church, or get back involved in my volunteer work, which I used to do? And then you can ask, well, what do you think is going to get in the way of that? And then you've sort of gone back to here. They say, well, I'm going to have these painful thoughts. And you can ask, well, do you think that you could make space for those thoughts to go ahead and do this because it's important to you? And the answer is usually yes. And then they'll come back in a week and you can ask, well, how did that go? Well, and they did the homework or they didn't do the homework. Either way, it can be what you talk about. What got in the way was I had poor motivation. Okay, well, we're going to talk about that motivation today. Or I tried it and it didn't work. Or I tried it and it turned out it wasn't in line with my values. And then you can, each time they come in, you get closer and closer to the goal of getting them towards value-based living. So I have a couple of quotes by Viktor Frankl. He was a psychiatrist. He was sort of before ACT was a thing, but he was a European Jew who was in a concentration camp during the Holocaust, or during World War II. And he talked about finding meaning despite being in a concentration camp. When we are no longer able to change a situation, we are challenged to change ourselves. Everything can be taken from a man but one thing, the last of the human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way. And the last one, between stimulus and response, there is a space. In that space is our power to choose our response. And our response lies our growth and our freedom. In Act Therapy, the goal is not that you're going to come to me and see me indefinitely. The goal is you want them to start to make changes in their life, and when they start to make changes, you can stop seeing them and just have them come back when they get stuck. And then the idea is that seeing people contingent upon there being problems is you're avoiding dependency. So some people have noted there are many similarities between ACT and Buddhism. And that wasn't intentional. The sort of inventor of ACT, Steve Hayes, he was familiar with Buddhism, but he said that he was not directly trying to pull from it. But it doesn't it's not surprising to me that people who are thinking about human suffering now have come to some of the same conclusions about people who've been thinking about human suffering for thousands of years. So I incorporate bits of ACT therapy into my med management appointments. Frequently I'll ask about mood, and then I'll ask about, well, what are you doing? What are your interests? Are you doing anything for fun? And if the answer is nothing, then I talk about, well, what did you used to do? And that's the way that I start to incorporate this into my med management appointments. The patient has to be on board. If you're going to do it, then the patient does have to be on board with the idea that escaping the emotions is the problem and not the goal. So with some people, you may need to do a bit of work before you're able to make those sort of statements. And you have to be careful to not work at cross purposes to other therapists. If someone is in psychodynamic therapy and they're closely examining their thoughts and you're trying to send them the message, well, no, let's just have those thoughts and go ahead and do what's important to us anyway. I think you can skin a cat more than one way, but you can't skin it more than one way at once. I think it's a bit of an open question about how do you decide which patients to do ACT with versus another kind of therapy. But things to think about are people who seem very avoidant or who seem to fall into that trap of seeming stuck, or people who are already interested in Buddhism or yoga or meditation. They also might be someone who I think about starting ACT with. And this is the Serenity Prayer from Alcoholics Anonymous, and I think it may have even predated Alcoholics Anonymous, but it's the same sort of ideas. They weren't originated with ACT, but they're definitely in ACT. And it's God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Does anybody have any questions or any thoughts? Anything they want to talk about? So the intersection between mindfulness-based cognitive therapy and ACT therapy and DBT. So mindfulness-based cognitive therapy and ACT therapy have an incredible amount of overlap, and they may use a lot of the same sort of exercises or patterns. But the goal in mindfulness-based cognitive therapy is, well, let's do this and then see what happens to your symptoms. Where in ACT therapy, it's, well, let's do this because it's important to you, and then just see what happens. Maybe you'll feel better, maybe you won't. But even if you don't feel better, at least you're living a life of your choosing. So that's the main difference. I would say the mindfulness-based cognitive therapy is still focused on symptom management, and ACT therapy is more about living vitally, just with or without symptoms. The intersection between DBT and ACT therapy, they're both considered third-wave behavior therapies. I mean, if you think a lot of what DBT is trying to teach are emotional regulation skills. From an ACT point of view, some of those emotional regulation skills are not value-based activities. They are ways to distract yourself or get out of the situation that you're in. And they may improve your life some, but they're not going to have a vital life worth living if all you're doing is distracting yourself from terrible experiences, terrible internal experiences.
I've been in some discussion of the use of this therapy with psychotic patients, and it's a little hard for me to sort of see how that would work. I know that it's contract written out. Can you comment on that?
So, I mean, people do have to have a certain amount of cognitive ability to do this, and you would think that a psychotic patient may be disqualified from consideration. My mentor for teaching me this was a doctor named Johnny Jerkin, and his own father had schizoaffective disorder, and he talked about how this had been sort of revolutionary in his dad's care, thinking, well, yeah, Dad, I know that you have this thought that people are out to get you and want to harm you. Well, let's think about what did you do last time and how did that go? So the last time you had these paranoid thoughts, you called the place and you called your boss and made a threat and got fired, and we ended up homeless. Is that something you want to do again? Or do you want to make space for those painful thoughts and just know that doing so is in the sort of in the value you get out of that is we get to continue to have a home and you could continue to have a job. Oh, absolutely, yeah. I think the whole goal is psychological flexibility, which they define as ability to cope with new stressors. Oh, absolutely. So Buddhism has many components. It has a component which is its understanding of nature and God and the soul, but in practice what people do is meditation, mindful meditation. Especially the Theravada Buddhists, that's the kind of meditation that they do. And the whole goal of the meditation is to be able to notice your thoughts. So during a regular, so I'll give you a bit of an example. The most common way to do mindful meditation is a breathing meditation. You start by focusing your attention on breathing, and then notice what thoughts come up. And you don't push the thoughts away, you allow the thoughts to come and go on their own. But when you're able to notice the thoughts, that's the whole goal. You noticed it. Good job. Your mind wandered, and you noticed that your mind wandered, and now you go back to the breathing. A lot of people who do that meditation feel that they've failed if their mind wanders, when in fact, when their mind wanders, that's a normal human experience, and you win when you noticed. But you don't have to be doing a sitting, breathing meditation to be mindful. You can mindfully eat, you can mindfully walk. If you imagine all of your brain is basically on autopilot for most of the day. And has mental shortcuts. And those are good. Those are good things to have. But imagine all of the stimulus that you're having at any given moment. If you imagine mindfully eating, I mean, that could be helpful for people who are working on dieting or have a history of eating disorder. You can sort of take note of all of the muscles that went into putting the food on the fork, or all of the muscles that went from putting the food to your mouth, all of the experiences with chewing, all the different tastes that come up. There are all of these experiences which, if your brain's on autopilot, you're going to miss them. You're not going to be in the minute. I did. There is a couple of sort of books or programs about group ACT. The one that we did was was sort of based on focused ACT. And there was a book, I think the name of it was, give me a moment, I'll think of a name. It's not coming to me. But we did more experiential exercises, so people didn't talk about their own issues as much, and it was more about, let's talk about a homework that everyone could do, about doing something mindfully, or noticing when the problems come up, and not trying to escape them. So for chronic pain, you would think of, I guess, two different things. It would be the acceptance and the committed action. Are there things that you can continue to do despite having the pain? Because people with chronic pain frequently have stopped leaving the house as often, or stopped going out, or stopped engaging with family members. And you want to get them re-engaged in things that they find meaningful. I guess the other part would be acceptance. There are some acceptance exercises that I can think about that I've used with patients with chronic pain. Usually something like a body scan meditation, or the more that we can describe it, the more space we get from it. So let's look at the pain. Where is it? Does it have a shape? Does it have a color? And now let's practice expanding around it. Or let's do a meditation where we breathe into the pain and breathe out compassion for all those who are having a similar experience. It's not going to make it go away, but you may be less focused on it. And now you are not a person who is a chronic pain patient. You are a person who has chronic pain. For the true ACT evangelists, they would tell you that there's no time that's not a good time to do ACT therapy, and there's no patient who's the wrong patient. I think that I would be a little more nuanced, and I would really, if someone has behaviors which seem not unreasonable, or they're not self-destructive, then I might not be as inclined to go down this route. But when people have clearly self-destructive behaviors, that's when I think about it more. Or when people are avoidant of their own experience. When people have the agenda of emotional control, and what I mean by that is, when memories come up, sometimes people will spend minutes, hours, days trying to fight that. Where I'm going to fill my mind with a million other things so I'm not having that thought. And you can point out to them, just like the simple exercise that's sometimes done with kids. Think about pink elephants. Now say pink elephants. Now say it 10 times. Now don't think about pink elephants. You're going to spend a lot of time and effort and energy into not thinking about it, but the more you're not thinking about it, the more it's actually in the back of your mind, right? The harder you try, the more it's there.
I think that applies to the pain issue as well. And the harder you fight it with kids, I heard somebody say you friend your pain, and that's a way of looking at it differently.
I think that's a great example. I've done similar things with people who have the same thoughts come up again and again, and they are not helpful, they're not workable thoughts. How about we name that thought? Righteousness showed up again. Righteousness is your friend. What's he like? So when that comes up, you can point out, oh, yep, their righteousness showed up again, and what are we going to do? Last time you did this, is that the way you wanted to go? Did you want to do something else? Last time you talked about wanting to do X instead of Y. Do you want to make a plan to do Y or X next time? Uh-huh. Mm-hmm. Well, I think the goal is to look at the thoughts as non-judgmentally as possible, and it's normal for a person to have upsetting thoughts. You seem to be having more than normal. But the only thing that we can choose to do is to notice them. How is that thought affecting you? Well, for thoughts that are coming up again and again, I think that you would have to make space for them. Let's make space for that thought. What is that going to look like for you? Or how about if we can predictably know that thought's going to come up several times a day, do you want to make a plan for what we're going to do when we have that thought? How about when the next time you have that thought, we call a friend, or we get present in the moment again? If it's a thought about the future or a thought about the past, and it might be a getting present exercise. I think there's a lot of different ways. Distancing from, make space for. I'm going to go back to that slide. So sitting with or opening up to, you could also talk about, how about we approach this as if we were a scientist? Let's describe this thought or this feeling. If you had never experienced this before, let's drop the good and bad for a minute and just explore it as, what is it like? I definitely think it bears saying that when you say acceptance, you're not saying you should want it, or if you are in an unacceptable position, so if you are someone who's in an abusive relationship, you shouldn't tell someone to accept something that doesn't seem acceptable. You should change what you should change and accept what you can't.
There was a fellow here for a lecture a few months ago named Ronald Wright. Maybe some of you guys read the lecture. It was about his new book called Why Buddhism is True. And he talks extensively about mindfulness, accepting and dismissing, observing and dismissing your thoughts, not viewing your thoughts as identical with yourself and your self-definition, and a whole lot about chronic pain.
Mm-hmm.
Basically the same kind of technique to deal with chronic pain. And view your life as a person separate from the pain that's applying to life. Very interesting kind of observation.
Yeah, I talked a little bit about this earlier, but in Western thought, you are your thoughts. I think, therefore I am. Without your thoughts, you wouldn't exist. In Eastern thought, in Enact Therapy, there's that part of your mind, but there's a different part of your mind. There's a part of your mind that can notice those thoughts. And that's the similarity between ACT and and Buddhism.
What about the medical model? It doesn't seem to be at one with the medical model of which symptoms are thought of as represented in disease state.
No.
Therapies or medications is something totally different.
So that's absolutely true. And in fact, some proponents of ACT therapy say, we shouldn't be calling this ACT therapy. We should be calling this training, because it's not just for people who have symptoms. This is how people should be living your life. At least that's what the true evangelists of it say. Learning this kind of therapy has sort of changed my approach to talking about medications with patients too. When I want to talk about prescribing medications, I say, well, let's try this and see if it makes space for, or let's see if we can make space for some of these feelings to help you make the changes you need to make, with the implicit assumption that you need to make changes in your life for you to be better in the long term, or for you to live the life that you find worth living. So the place that it comes up the most, I mean, if you imagine if someone has depression, you can say, how has your mood been doing? And then one of the symptoms of depression is decreased interests. So you ask them, what have you been doing for fun? Or what have you been doing in general? And that's where you're going to find a lot that they may not be doing things that are that they find valued-based, or they may not be doing anything at all. One of the most frequent responses I get for what are you doing for fun is nothing. Or what does your day look like? And they say, well, I sit. I sit at home the whole day. And many people who are on disability, or who have chronic pain or bad medical problems, or who are retired, and they are sort of have an object at rest stays at rest. And part of the goal is to get them back involved in things that they find meaningful. So that's probably the most common way that I incorporate it. The other would be people who have medical problems like chronic pain, or real limitations like neurologic issues, for making space for that. How are we going to move forward? Some people say, my life was defined by the story that I was a runner, and now I have MS and I can't run. So you're going to have to do some acceptance-based strategies with them around how to, what are we going to do now that's going to be in line with your values. The wading through the swamp, I can't remember if I talked about that one or not. So if you can imagine, you've talked to somebody about their goals, and they say, my goal is to get married, or whatever it is. You can't go out and be married. There's going to be a whole process to do that. And it may involve painful experiences. They're likely already having painful inner experiences, which is why they're coming to see you. But it's, can you make space for those painful experiences in the name of reaching that end goal? So if you're a mountain climber and you want to climb the mountain, but in front of you is a swamp and you have to get through the swamp to climb the mountain, it is worth it to you to wade through the swamp and get to the top of the mountain. The mountain climber metaphor comes up several times in ACT therapy. Sometimes you can talk about, everyone's on their own mountain. I'm on my mountain and you're on yours, but me being on an outsider and not on your mountain, I'm able to see the route to the top, and the route that you're taking doesn't appear to be getting to the top. Short term. I mean, I think you could make an argument for either one, especially people who think of this as a training or a skill, something you shouldn't be just doing when you're sick. You should be doing it when you're well as well. But I think about this as a short-term intervention, a brief therapy. So, in the one that I did, it was more people who are already interested in mindfulness or meditation, and we would propose it to them. I think that it would be interesting to incorporate this into like a substance use clinic or a Suboxone clinic especially, but we didn't do that, but I think it would be interesting. But people don't have to share a diagnosis to share the problem of being avoidant of their internal experience. It's me, you, and everybody. There is, and I didn't put it up here, There have been multiple clinical trials comparing it to various forms of therapy, including cognitive therapy for depression, anxiety, panic, chronic pain, and it appears to do pretty well. I'm not sure that there's been one study so far that's had a bad outcome with ACT therapy. So this went a little faster than I anticipated, but if there aren't any more... Uh-huh. I think that's a little bit beyond the scope of my understanding, so I wouldn't want to wade into answering that question. All right. Well, thank everybody for coming, and thanks for listening. I appreciate you hanging in till the end of the day.